Very good. Can you go share a sound? I couldn't make it share around.
The sound is already shared.
Trying to mute everybody. Okay, muted them. Which one? Share a sound, so it's three. One. Share this thing. Share it. It is somebody share. Good evening, everybody. Good evening. We'll be starting very soon. People are still trickling. We'll be starting. Chakal. Good evening. Today's topic, welcome everybody. We've got enough people.
Good evening.
This is Tuesday today, the 24th of January.
Wednesday.
Tuesday. Why are you not muted? I'm trying to mute you all, but you are muted. Okay, allow you to unmute yourselves. Today is Wednesday, the 24th of January. And as in the invite, the topic for today is not purely gynecological topic, but gynecologists deal a lot with these things. It's a multidisciplinary topic. It needs a lot of disciplines to deal with. So the topic is about human sexuality. We will discuss various aspects of sexuality. We'll also touch on some sexual disorders and paraphilias, but it's not only confined to this one. I'll touch other things that are related to sex and gender. You know, sexual attitude restructuring is a process of or education or therapy designed to help individuals and couples to examine their beliefs about human sexuality. Everybody has got a belief about human sexuality and change from a negative to a positive point of view about sex. People have got a certain attitude towards sex and sexuality. The aim of this health education, maybe it can help you to change from having a positive attitude towards sex and sexuality. And this is based on the following: in the fact that sex plays a very important role in every person's life. It's very important. You don't talk about it, but it's very important. Things like sexual fantasies, sexual desires, and sexual behavior should be recognized as valuable and should be recognized as valuable an integral part of each person's total life. Everybody should have a good sex. Sex can and should be discussed casually in a non-judgmental manner. Every individual has got the right to know the facts and to enrich himself about the sex and sexuality, and then enrich their life by learning a full range of sexual behavior. Everyone has the right to have a good sex. It doesn't matter who you are, including the person who have physical and mental disability. Even the paraplegics, the amputees, the diabetics, patients with heart disease, even mentally retarded, they've got the right to have good sex. Whether you're emotionally disturbed or not, that right, you don't relinquish it. So sexuality is one of the most individualistic part of person's life. It is up to each person to determine and then to assume responsibility for his own style of sexual expression. To experience a healthy and fulfilling sex life, people need to learn about and appreciate their bodies, know their feelings, and know their sexual response cycle. Become sensitive to the needs of others and develop meaningful and intimate contact with their sexual relationship. The educational or therapeutic methodology consists of desensitization. You must desensitize people to sexual myths. There are a lot of sexual myths out there. One of these aims of this education is to desensitize those sexual myths and representation to the sexual fact throughout this lecture. My name is Dr. D.T. Mahapa. I'm just a urogynecologist here in Polokwane. This topic, I found it very, very much complex. So I felt that I cannot deal with it alone as Dr. D.T. Mahapa. I've been knowledge-wise, I've been deficient, I've got some limitations. So I invited multiple disciplines to come and help because it touches a lot of disciplines. I invited the pastors, where I invited Dr. Reverend K.L. Ekhafela of URCSA to come and be with us during discussions and help us to unravel this topic. Unfortunately, he will join us later. I hope he'll join us because he's just SMS'd me and said he's still in a prayer meeting. He'll come and join us later. And we have got another reverend here who is a medical doctor by profession, but is also a reverend, a qualified reverend, Dr. Machachi Makoti, Dr. Reverend Machachi Makoti, who is a medical doctor and a pastor. They'll help us during the discussion here to answer some questions and to clarify some issues. And also you people, I think you can even add. You don't have to ask questions and add because we are discussing, I'm not telling you. I call clinical psychologists, not only one, many will be joining, but on the panel we have got the head of Department of Clinical Psychology in the University of Limpopo, Medical University, Ntabiseng Ramutwala. I hope she's with us here. She also, some of the concepts, especially when it comes to the paraphilias, she will enlighten us a lot and educate us. With her, I've got Ntabiseng Ramutwala is a clinical psychologist from Pretoria. The head of the psychiatry in the University of Limpopo is Dr. Pule Mokoena Mleb. She's a psychiatrist by profession. She will help us together with the clinical psychologists to understand, because they are the one who deal with these things more than us. And this topic has got some legal implications. I invited several lawyers, but on the panel we've got an attorney, Matumi Chidi, who will be with us. Firstly, let's start. What is sexual orientation? When it's said, what is your sexual orientation? It has to do with the sex of the preferred sex partner or the gender of the preferred sex partner. Later we'll differentiate between sex and gender. Now, what is sex? What is gender? What is the gender of your preferred sex partner? That's your sexual orientation. There is the experience of attraction to people of specific sex. Some people are attracted to people of particular sex. For example, if you're attracted to the same sex as you're regarded as homosexual. Like the people in the gays and the lesbian. Gays are attracted to the same sex as they are, which are men, the lesbians are attracted to same sex as they are, which are females. If you're attracted to opposite sex, like the majority of the people, they are called heterosexuals, or sometimes in the street language, they call them, they are straight. If you are attracted to both, you are attracted to people of your own sex, and you're also attracted to people of the opposite sex. It's said to be you're bisexual. If you are attracted to neither female nor male, you are not attracted to anybody. You are regarded to as asexual. Asexual per se is not a sexual orientation because you are not attracted to anybody. Sexual orientation is that unique pattern of sexual or romantic desire or behavior and identity that a person expresses. What is sexual identity as opposed to sexual orientation? A sexual identity is how an individual define themselves as. If you are attracted, for example, you are attracted to the same sex as you, but say I'm a man, I'm attracted to the same sex as a man, so which means I'm a gay. But in that relationship, I regard myself as a female. That's my sexual identity, and that should be respected. When you address me, you must address me like a male. You must say she. You mustn't address me as he. That's my identity, how an individual define himself as. Sexual identity. What is sexual interest? Describe what an individual wants to do. What you want to do is your interest. Whether or not you actually do it or not, it doesn't matter. But the fact that you want to do is your interest. By definition, sexual interest implies that they provoke sexual arousal in an individual. Another thing that we must understand in this sexuality is sexual behavior. What is a person's sexual behavior? Sexual behavior is not an interest, it's not an orientation. It's what an individual actually do. Whether or not they not do is connected with their sexual identity or their sexual interest. The sexual behavior may not or may be described and may or may not be arousing to the individual. Sexual behavior can be expression of one's own sexual interest, but it's not a sexual interest. It can be an expression of one's sexual interest, but in that way, you do it. The sexual interest is what you want to do. Sexual behavior is what you actually do. So we must differentiate between those terms. I had said earlier on that if I say somebody is asexual, we categorize sexual orientation into three categories. We have got heterosexual, which you are attracted to the opposite sex than you. Homosexual, same-sex attraction, bisexual. Those are the three categories of sexual orientation. Asexuality is not a category because it's lack of orientation. You've got no orientation. You are not attracted to men. You're not attracted to opposite sex. You're not attracted to your sex. You are asexual. Lack of sexual orientation or lack of interest in preferred sexual activity. We must differentiate asexuality from being celibate. So asexuality doesn't mean celibate. Because although both asexual people and celibate people both avoid sexual activity, their reason for avoiding sexual activity, they vary. An asexual person is simply not sexually attracted to anybody. Those who are celibate may actually be sexually attracted, but they take conscious choice or decision not to act upon those feelings for a period of time. So a celibate person says, I'm going to become celibate until I finish my studies, I'm going to be, but he's sexually attracted. Asexuality is not a sexual dysfunction per se, or a fear of sex. It doesn't mean fear of sex. When asexual and non-sexual women were compared different and studied, they found that they've got the same hormone level, they've got the same behavior. There's no difference in the studies that they said. So asexuals are not necessarily sexually inexperienced or not. Asexual people can actually have sex, and some people can also, some asexual people, they are married, but they're asexual. Example that I can give is type in a couple where there's a married couple, they have sex, they've got children, but the wife has got no interest in sex at all. She never initiated anything. she's not frigid, but she's got no interest. She just do it because it's part of the marriage package. She has to do so to satisfy the other partner. But her herself, she's not attracted to anything. She got married because marriage is one of the milestones that every man should go through. Another thing that we should understand is gender identity. It is one's internal or personal sense of being a man or a woman, or a boy or a girl. We described it later. For transgender people, their birth assigned sex, if they assign him as a female, and their own internal sense of gender, they differ. If they assign him as a female as transgender, he feels that he's a male. That's why they even go to an extent of doing surgery to change their gender identity to fit the internal gender that they identify themselves as. One of the things which is here, which I think the psychologists will help me, is pansexuality. Seems to be the opposite of asexuality, and the attraction of a member to all sexes. This person is attracted to people of the male sex, and is even attracted to the female. Is a pansexual. Even attracted to the transgender people. So in sexuality, we must differentiate between the lust and desire. Lust is not a desire. Lust is a strong and persistent attraction to an attribute or potential partner or specific sexual act. You look at a partner, you see a certain attribute to her, you see the curves, you see the breasts, you see the beauty, you are attracted to that person because of that. That is lust. It should not be confused with desire, which is an unfocused interest of pursuing sexual or arousal. Desire is just a person just feel that I feel like I need to have sex. It's not focused to anybody. And the lust, as opposed to desire, it continues even after menopause. Even if those hormones that drive sexual drive are out, even if a man is about 80, 90, he still has a lust. He might not have erection, but he still has that lust that he could have it. He wants to, but the body cannot do. Sex is a fluid thing. Sexuality is a fluid thing. That's why we've got what you call sexual fluidity, which may include changes in attraction. For example, I'll give it to you an example. One may be attracted to one gender at one time or point. So you're attracted to heterosexual gender. You are straight, you are a heterosexual person. And later, you change and be attracted to a different gender, which means the gender has moved from one attraction to another one, or more than one gender, which means you've changed from sexual orientation to another one. That is fluidity of the gender. It changes in identity labels. Someone will identify herself as a lesbian at one time, point, and later he becomes bisexual or he becomes heterosexual. So it's not uncommon for homosexual to change and be heterosexual. It's not uncommon for heterosexual to change their sexual identity to be heterosexual and vice versa. So sexual fluidity, normal sexual fluidity happens in everybody is this way. Sexual orientation evolves and changes in preferences, just as most adults are sexually attracted to their own age. Usually, you are attracted to a person of your similar age as you, and not those of a younger age or very old. Change is seen in that in your youth, you are interested in small boys or girls. And as you age at around 50, 60, you are likely to be interested in people approximately the same age. It's uncommon already, as abnormal for a man of 50 to be attracted to small children. That one will be a pedophile, or vice versa. You are attracted to more or less the same age group as you are. That's why we say there's another form of sexual fluidity. One thing that we are going to understand in this is the LGBTQ. We won't discuss them much in detail, but our lawyers and psychologists, including our reverends, will probably touch this because the Bible also touches it, the legal aspect thereof, and they deal with them more. LGBTQ means lesbian, gays, bisexual, transgender, and queer people. Let's touch a little bit about transgender. It's not very common in South Africa because our plastic don't do much. We don't treat them as much, but they are there. The feeling might be there psychological, but we are doing disservice to them. In transgender identity, The gender identity is different from assigned gender. A person at birth is assigned as a boy, but his gender identity is that of a female, or vice versa. I said earlier on that gender identity is your internal knowledge of your gender, where you know what you are, irrespective of what you look like. As opposed to gender expression. Gender expression is how a person expresses his gender. It might not be his identity, but he expresses that behavior. Like a man who knows that he's a man, but he expresses the gender of a female. He put on dresses, he put on... a good example is a female who knows that she's a female. She behaves like a female. A gender identity is a female, but the expression is that of a man. We call them tomboys. He put on trousers, he talks hard voices, he talks tsotital, but it doesn't mean his gender identity is that of a man. It's just a gender expression. He expresses the gender, opposite gender that he is. In the LGBTQ, a gender identity should be respected. And even transgender, if she identifies herself, you must ask her what he is. You must know what he is so that you can address her appropriately. If he's a he, address him as a he. If she's a she, address her as a she. So not the sex of birth, a gender identity. Gender and sex, what are the differences? Sex is used medically and scientifically, and it's chromosomally determined. Like we say, females have got a 46 XX, double X chromosomes. Males has got 46 XY chromosomes. That is sex. Gender is what a person is reared as, like you're male or female. That's why gender can change irrespective of the sex. The fact that in homosexual the gender can be different, it doesn't mean the sex is different. Genetically, she'll still remain, if she's a male, she'll be 46 XY, but her gender will change. So that's why there's a period of gender transition, because gender refers to a characteristic of a woman or a man or a girl or a boy that are socially constructed. It's not genetically constructed. And why we have now, because with liberalism and new laws after 1994, previously Africans, they knew how to spot gender transition. When a person is changing from the real as a boy, if he's changing to be a female, behave like a female, they can spot it quickly. So that's why they have strict activity that belongs to boys and strict activity that belongs to girls. One would regard that as a gender suppression, but it's not suppression. It's just to spot it so that this boy, they can see him as he grows, that as he grows, if we leave him doing these things, he's going to behave like a woman. Or if a person, if we leave him doing this thing, being a girl, he's going to behave like a man. They will spot it and reprimand you very seriously. I remember when we were still young, if you don't want to go and look after cattle with other, or look after goat with other boys, you remain here with girls because you associate better with girls. Girls will sing a song about you and scold you and say, that way you won't be able to associate with the opposite sex because they don't accept you here. So, but with gender equality and liberalism, this is gender expression becomes more, even if in girls. That's the danger of gender equality. There's no time to suppress that. That's why we've got people expressing gender that are different from gender that they were assigned at boys. Previously, you wouldn't do that. We wouldn't have that many of that because as they grow, boys must go to live with the male. Girls must live with the women and in the kitchen. And there was clear defined gender roles. There's no way to play another gender. And if you play the opposite gender role, you are reprimanded and that social consequences there, including punishment. That way it was not. But now it's no more there. So gender expression is easy. What are the best social norms, sexual norms? What is expected as an acceptable sexual behavior in human? The word norms come from normal. What is the normal expected sexual behavior? It affects men and women and trans people in relation to both same and opposite sex or partner. Acceptable sexual act is penile vaginal intercourse. because this is what's going to lead to reproduction if sex was meant for reproduction. But if sex was meant for recreation, any form of sex can be done, which will not yield any offspring. But acceptable sexual act is penile vaginal intercourse. That is a normal sex. That's why you say names. Other form of sexual behavior or sexual acts are usually unacceptable in most community or are regarded as abnormal sexual behavior. We'll discuss several forms of sexual behaviors and see what they are. Sexual norms and behavior. What influence them? Our religion, irrespective of what, whether Christian, Hindu, Judaism, anything, and your culture, depending on your culture depending on where nationality you come from, and your upbringing influence your beliefs about sexuality, whether you like it or not, and influence your sexual norms. I always ask myself a question. Is sex made for pleasure? Is it made for recreation or procreation? I've never answered that question to the fullest. Because in the animal kingdom, sex, animals, I mean animals like wild animals and domestic animals, excluding human being. I'm not saying human being is not an animal, it's also an animal. Other animals except human being. Sex is a recreational activity. They go on heat. They only make love when they're on heat. You can see dogs, they don't just make love willy-nilly, randomly. So they are for procreation. But human being is one of the animals, human being and macaca monkey. I'll show you macaca monkey and some monkeys, which are relatives of human being, of course. Evolutionary, we come from the same family as those monkeys. They have sex for pleasure, just for recreation. When they're bored, they have sex. Human norms and animal norms, they differ. Norms come from the word normal, as I said. It's acceptable to see nowadays young children romantically involved in public and in the streets as part of recreation. But this is how behavior these days has been. And when I want you to crowd to tell me, is it what we should allow to happen or not? Because I'm sure those who are about 50 years, 60 years, you have never seen your mother kissing your father. You have never seen, nobody has ever seen you walking in the street with a girl, covering a girl midday. But this day it's not uncommon to see young boys and girls in the street near the telephone pole kissing each other. Is that evolution of sexual norms or is it deterioration of morals? I've got no answer for that. But in future, if we're not careful, we don't control this normative behavior, we're going to find yourself in a situation where we are not different from animals. You know, animals can make love in public. We are going to, if we leave it to go like that, I think there will be a stage where people just make love in public without any knowledge. So we better just walk undressed. And sexual norms and behavior, we accept that they vary with time, but they should vary and change for the right direction, not the direction that we see them going now, where you see in front of adults, small children, they're just kissing each other. That's why we've got so much teenage pregnancy and anything. So normally, if we were to be on heat like animals, sex should only take place between people who are married and in a serious romantic relationship. Casual sex is not what it should happen. It should happen between male and females, normal sex. Sex should only be for procreation, not for pleasure, but human being has got this instinct, which I think it took from the animal behavior from the monkeys, that they can have sex for pleasure. But even if it's for pleasure, casual sex is immoral. Even the Bible doesn't want it. You can't just say because you're together with this person who is an opposite sex, the best thing we do, let's just make love. And there's no romantic attachment between you. You know, our society has adopted unacceptable sexual behaviors. When children are bored, what do? They don't read. They don't go to play sports, recreational sports. They rather go and look for other children of the opposite sex and have sex. That's why we've got children having children. We have normalized abnormal behavior. That's why we've got so much teenage pregnancy, so much HIV, high level of infidelity, And most people in South Africa, among the Africans, I'm an African. I'm not being racist. Nobody can say I am a racist because I'm an African. Most people among the Africans, because why I say so, we don't see other races, the Indians and the whites, queuing for grants, having children, having children, not knowing who our fathers are. They still maintain their norms, but we're losing our norms. So during the discussion, I think some of the legal people will tell us whether we are losing or not is because of what do you call liberation. Liberated from what? You can't liberate yourself from the norms. This is a macaca monkey. This is the only monkey that I know that can make love for fun, like human being. So human beings' behavior is like this monkey. These monkeys can make love even if they're not on heat. Love for fun. So if there are two animals that can have sex for fun, it's a macaca monkey and a human being. So we behavior are like the behavior of a monkey, of this monkey. But the question is, who started the behavior? I'm not sure of the answer, but evolutionary, our monkeys are older than us, which means we copied from monkeys. We copied monkeys' behaviors. So we have got monkeys' behavioral pattern. Another thing that we should know and understand as a community is homosexuality, especially in South Africa. Because sexual orientation is defined by whom we are sexually attracted to and also have a potential of loving. If you're attracted to the same person and have a potential of loving that person, that's your sexual orientation. In Greek, the word homo means same, while in Latin, the word homo means man. So the homosexual, it comes from the Greek word, means same sex. While in Latin, homo, I said it means man. So that's why a human being is called homo sapiens. That's Latin. The word homo sapiens, they coined the Greek homosexual, they coined the Greek word homo with the same and make homosexual. And of the homosexual, you've got two great types. The lesbian is a female homosexual. The word lesbian is derived from a Greek poet, very famous Greek poet, who lived in the island of Lesbos. That's why it's called lesbian. This Greek poet, Sappho, was not a lesbian. He just made so many poems about love and made poems about love of the same sex, female loving a female, male loving a male. Then if a female loves a female, they said it's lesbian because named after the poet who made good poems about same-sex orientation. While the word gay is just a pure English word, which means carefree or snowy. It's not derived from anywhere. In Africa, like we are Africans, in the United States, let's start like this. A male who is attracted to a male is said to be androphilic, like gays are androphilic. A female who is attracted to female, like lesbian, they're gynophilic. And that's why gynecology is a person who deals with females. When they gynophilic, which we are attracted to females. Because gynophilia, attraction to females, is not less visible because it's a common practice for females to be very close friends, find that they sleep in the same bed, they walk the same, they dress the same, they're big chummies. But if men can have that friendship where they sleep the same house, same bed, they go the same everywhere, we start to doubt whether are they not gays or what. But females have got a tendency of making very intimate friendship without any romantic relationship between the two females. So it's very easy, it's not easy to spot lesbianism unless they pronounce it, because it's normal for females to have a close friend. There was a long time, a lively debate about whether, in America, that is about whether same-sex marriage should be recognized or not. Very long time. Though at present, in all states in America, same-sex marriage is allowed. And we tend to copy from America, we never think anything original. Opinion about legality of same-sex marriage are closely related to opinion about morality of a sexual relation between same-sex adults. As I said, religion and religiosity seems to too strongly influence both of these issues. Like people who are going to church, church-going people, irrespective of whether you're Christian or a religion, whether Hindu or anything. To them, sexual relations, same-sex relation are a violation of the basic values of that religion. If it's Christianity, it's a violation of basic values of Christianity. And these church-going people consequently oppose same-sex marriages. While the liberals here in the term, I mean those people who are generally secular, they don't go to church, they don't belong to any religion, recognize that homosexuals and same-sex marriages are disadvantaged minority, and see same-sex they see same-sex marriage as a civil rights issue. So there are two schools of thought between the church-going and the liberals who are secular person. So sexual orientation, which include attraction, sexual preference, sexual identity, and behavior. If same-sex attraction is defined as sexual arousal in response to the same sex, well, different sex is in those people who are straight and heterosexual. So sexual preference of an individual should be respected in any way, but are the norms of the society allowing that? So in Africa, we come into Africa, it's no use talking about America. This debate is also going on. But some countries have put their heads on the block. Some has not put their head on the block. Some has just copied from other cut and paste. Like only last year in Uganda, they passed a law.
Life in prison, even the death penalty for being gay. In Uganda tonight, that's reality after President Yoweri Museveni signed one of the world's most draconian anti-gay laws.
When you commit aggravated homosexuality, the law says you shall be liable to suffer death.
Because even in countries in Africa where there are not laws that explicitly outlaw homosexuality, there are very high rates of homophobia. Life in prison, even the death penalty for being gay. In Uganda tonight, that's reality after President Yoweri Museveni signed one of the world's most draconian anti-gay laws.
When you commit aggravated homosexuality, the law says you shall be liable to suffer death.
Because even in countries in Africa where there are not laws that explicitly outlaw homosexuality, there are very high rates of homophobic crime and even violence targeting LGBTQ people. And on the flip side of this, only one country in the entire continent has legalized same-sex marriage. That country is South Africa.
So it tells us that here in Uganda, they passed a law that there's death penalty for being gay. But in the entire country, only South Africa is the only country that has legalized same-sex marriage. In many countries, they discuss this, and some people have given their thoughts about it. South Africa has legalized it. Sorry.
Zimbabwe's President Robert Mugabe is 91 years old, but his age hasn't stopped him from going on the offensive against the West. No surprises there. His speech to the Zimbabwe's President Robert Mugabe is 91 years old, but his age hasn't stopped him from going on the offensive against the West. No surprises there. His speech to the UN General Assembly harped on some familiar themes.
We equally reject attempts to prescribe new rights that are contrary to our values, norms, traditions, and beliefs. We are not gays.
That was Mugabe in the United Nations General Assembly stating clearly that he's opposed to new rights that are contrary to our beliefs and norms. And he says we are not gays. That was Mugabe. He speaks his word. He doesn't play around. So we in South Africa, we have legalized it, and we must respect the government. Let's go straight to gender and sexuality. Men by nature, they think more about sex, and they want more sex than women. They want more sex even with different partners. That's why they've got more partners. That's why polygamy usually is from men with many. Polyandry is not much accepted. In South Africa, there's this thing we can allow polyandry. It's not easy. A female by nature would not allow polyandry, but across all cultures, men think more about sex and want more sex. But contrary, men are the one that has got more sexual dysfunction as they age. We'll discuss some sexual dysfunction later. As opposed to women, women's desire for sex is related or linked to the relationship status. A woman will not have to have sex with somebody who's not intimately or romantically attached to. They tend to be more ashamed of appearance flaws. It sort of become disgraceful if a woman can just make love just because of making love, but without any romantic attachment. It's got a feeling. And in all ages, irrespective of age, if there's some sexual dysfunction, women are likely to report it for treatment than men. Men can stay with it and deny it while it's still there. That's why men and women, if you look at any community, across all community, if man has got more than one concubines or more than one female sex partners, he's not called with derogatory names. Actually, he's praised. They call him Elbow, Jabana, Money, Casanova, and all those things. All names that they actually is elevated. But if a woman has got more than one sex partners, the names that is named here are very derogatory. You can't mention them here. Some they call him dog, Mukwandi, all these things. All derogatory names to discourage a female from having more than one partner. The word Casanova, the Casanova is a man. I wanted to tell you about Casanova. When I was reading this, I met about this man. This man's name is Girolamo Casanova. The word Casanova, when they say man is a Casanova, is because it's named after this man. This man was a writer, an author, was an Italian writer and author. He lives in Venice. He was living in Venice. They say he seduced so many women, and women were very much attracted to him. In his life, according to Casanova slept with 136 women in his entire life. That's why if a man is like that, they call him a Casanova, named after the man Girolamo Casanova. So we have got Casanovas out there, but they'll never reach Casanova's record of 136 women. We need to know a little bit about sexual response cycle. I put the slide just for education because it's important for later discussion. Every human being, whether man or a woman, a cycle is like the graph here. Arousal starts with excitement. As sexual excitement goes on, it reaches a place where it's plateaued. You're excited, there must be a plateau during sex. But later, during that plateau, there can be a peak, which is climax. In a female is orgasm, in a male is ejaculation. And after that climax, everything goes down to resolution to the bottom. You can see the graph that after climax, it resolves back to the bottom. And the difference between men and women in this sexual response cycle is that in a woman, immediately goes down. You can start again, excitement, plateau, and climax, which a woman can have multiple orgasms over a long time. But with a man, there have to be a period which is called a latent period. It can be 30 minutes, it can be 20 minutes, this period tends to increase as the man ages. If you are at about 60, 70, after one sexual encounter, the resolution can take even about a month. The next erection will come after a month. The same with a woman, it becomes longer, but in a woman is shorter than in a man. So this is sexual response cycle. So if a person has got infrequent sexual stimulation, look at the age. At a certain age, the stimulation will not be as frequent like at a certain age. So that's why we should understand that. And the anatomical difference between men and women, nobody has to tell how it is. God designed it such that It fits like a mosaic, one fit into another, so that because sex, God made it for procreation. But if you've got sexual dysfunction, now we come to our psychiatric friends will help us. I find 3 distinct categories of sexual dysfunction in DSM-5. Is sexual desire, arousal, and interest disorders, disorders of desire, arousal, and interest, and orgasmic disorders, number 2, and sexual pain disorder. This is what we were going to discuss. In women, sexual desire, arousal, and interest disorders, they are more common in women, although they are there in men also, but they are common in women. In men, what is common is male hyposexual disorder or erectile dysfunction, the inability to maintain erection of sufficient stiffness to can cause penetration. This is called erectile dysfunction. Orgasmic disorders are primarily female disorders. There are female with orgasmic disorder. There are females who are in a stable relationship for years, even married up to menopause. They have never experienced orgasm because they've got orgasmic disorders. They try, the majority of them, they don't even, because they don't know what orgasm is, they don't feel bad, because if you don't know how a sugar tastes, you can't say, I want something sweet, because you have not tasted anything sweet. But majority of them, if you describe orgasm, they wonder what is orgasm. I've never felt that. Those people are orgasmic, they've got orgasmic disorders. They are called anorgasmic. It can be primary, it can be secondary. If it's primary, it means the woman has never had orgasm in her life. If it's secondary, the woman who used to have orgasm now suddenly is anorgasmic, which psychologists usually treat. There must be a psychological factor involved in that, or psychiatry. Or it might be situational. You find that a female has got orgasm with a certain partner, with another partner it doesn't have orgasm, because sex and mind, they go hand in hand. But in men, because orgasm in men is called ejaculation, they rather have delayed ejaculation or impotence. Delayed ejaculation is very difficult. You must define it very well, because if we say delayed, in relation to whom? If it's delayed in relation to an orgasmic woman, which means ejaculate before the woman gets orgasm, you will call it a premature ejaculation because you've got an anorgasmic woman. So you must, there's no time limit to time it, but you can't say, if it's delayed and until the woman gets orgasm before the man ejaculates, you call it delayed. Like early ejaculation. When you say early ejaculation, what do you mean? You mean before there's simultaneous orgasm. If the woman gets orgasm very late, probably you'll call that man early ejaculator. Well, actually, it's not an early ejaculator. History must be very intense for both sides. That's why when you treat these disorders, treat the whole couple, because there has to be synergy in the couple. The third one is sexual pain disorder. With women, we have got genitopelvic pain during penetration, terrible pain. And that pain is not caused by any disease. There's no pelvic infection, there's no endometriosis, there's no ovarian cyst, there's no infection, nothing, but she just has sexual pain disorder, which psychologists will define very well for us. Disorders involving sexual interest, desire, and arousal. Is that the first category? Persistent deficit in sexual interest or sexual fantasies. It's persistent. It doesn't, it's been there and it continues. While hypoactive sexual desire disorder, which is in men, is deficient or absent sexual fantasy or urges. He never thinks about sex. Let me say, every human being, female or male, when they're still strong, they must think about sex. Sitting alone, you must think about sex. If you don't think about sex, although you may not express that you are thinking about sex because of societal expectation. If you're a female, they'll say, "Hi, what kind of a female you are? You like me." But you think about sex. You've got fantasies about sex. You've got these dreams that about sex. You've got the need to have sex. Whether you've got a partner or not, you will have that need to have sex. So that's a normal human behavior. It's not something that one should shy on. If you think about sex alone, you feel like you want to have sex, it's a normal behavior. Everybody behaves like that. Whether you do it or not, is another story. Men with erectile disorder, as I said, they fail to attain or maintain erection of a penis sufficient turgidity to cause penetration. So these are the disorders that are more common in women. In the past, negative societal attitude about women and sexuality were a significant barrier to scientific inquiry and medical treatment of female sexual disorders, because a female was not supposed to enjoy sex. So we do spot female sexual disorder, they won't come in. But nowadays, women are liberal. That's why I've said they are more likely to report sexual disorder than male. The female sexual disorder research was focused mainly on contraception, unwanted pregnancy, sexual violence, prevention of sexual transmitted disease, HIV and AIDS, and so on, which is not usually sexuality, as they say. But these days, female come forward, you can ask them about sexuality, they can be treated. Majority of psychologists that usually do sex therapy, they go deep into this and they know better than even ask gynecology. Absence of orgasm after sexual excitement in many women is what we call female orgasmic disorder, is what we call anorgasmic women. Many women achieve arousal, but not orgasm. They get aroused, but not orgasm. They don't reach that climax. That's why they're called anorgasmic. While in men, if ejaculation occurs too quickly or before the female partner reaches a stage where she can reach orgasm, is said to be early ejaculation. That's why I said early ejaculation in relation to this particular partner, because with a partner with quick orgasm, ejaculation might be simultaneous. So it's difficult to define that early ejaculation. Don't jump into early ejaculation. Like delayed ejaculation. Delayed what? Because the partner came on before the female. It's very difficult, but sex therapists, they tend to ask both and go into history. But if a man has got a persistent difficulty in ejaculation, usually in that case, they either posterior urethral valve, or they've got other abnormalities of the male reproductive system, or they have had epididymal blockage, and so on. The sexual pain disorder, the third category, is the DSM classified as sexual pain or penetration disorder, which is persistent and recurrent pain during intercourse. Every time during intercourse, there's unbearable pain. It can be both men and women, but it's common in women. It's very rare in men. And for you to make that diagnosis, you must rule out things like infection, lack of vaginal lubrication, like postmenopause, endometriosis, things that can cause pain. You rule them out, then you say this is genitopelvic pain disorder or penetration disorder. Most women experience sexual arousal and orgasm from manual or oral stimulation that does not involve penetration. Such women, they avoid penetrative sex. With that, I deliberately, which is not in DSM-3, put in vaginismus and dyspareunia. Dyspareunia means painful sex. Vaginismus, what is vaginismus? Vaginismus is the body's automatic reaction to the fear of all types of vaginal penetration. If the body fears vaginal penetration, let me have water. The body will respond in a certain way. Whenever penetration is attempted, the vaginal muscle will tighten up on their own and close. And the woman has got no control over it. Whenever there's penetration attempt, the vaginal muscle, they close. Occasionally, you get vaginismus, even if you have women who have had previous penetration, they can have secondary vaginismus from psychological, maybe from rape, from relationship problem, from psychogenic fears like guilt. Usually it happens, psychogenic will be like guilt. For example, if a woman is making love, a married woman is making love with another man who's not his, but is guilty, and he knows that if this can be known, hell will go loose. Automatically, the muscles might just clasp and then close. There are situations, many situations, even in the community we've seen them, where a man and a woman, they were caught making love, and the man cannot come out of a woman because the woman got vaginismus while the man is inside, and you have to carry them, two of them, to bring them to casualty or take them to the inyanga to be given casualty. They give them some muscle relaxant and come out. And in Africa, we believe in African medicine, which is part of medicine. I think it must be taught at school. In Africa, if a woman is locked in a man is locked in another woman, they say the husband went to Johannesburg to go and work, but he locked his wife. You can't go in. There's nobody who locks somebody. It's just vaginismus. It happened because that woman is doing that, but psychologically, the muscles contract. Majority of them, they contract before penetration, so you can't enter. But if you enter and contract inside, the constriction becomes so hard that it's difficult to take out that penis out there. So they have to carry them, the two of them. What a shame in the community, because they carry them clasped together. There are several causes of vaginismus. Emotional causes, and physical causes. Emotional causes of vaginismus, where the muscle is just closed and not allow penetration, is part traumas like sexual abuse. If you've got sexual abuse and not well healed, you will have vaginismus. And the history of painful sex in the past, they will think you're anticipating pain. Or strict upbringing where sex is not discussed or seen as a taboo. That's why I say that sexuality should be discussed liberally, because little knowledge about sex can cause vaginismus. Physical causes is oversensitive nerve at the opening of the vagina. If the nerves are oversensitive, or inflammation at the end of the vagina, or you've had difficult childbirth, or you've got this psychogenic fear of going through that childbirth again, you will have that. And the side effects of certain medicine can cause that. So there will be automatic response of these muscles around the vagina, which is the muscle that will just contract and close the whole vaginal or opening, is vaginismus. It's more often found in the locations in the village there. People are found like that. And even traditional healers know how to treat it. I don't know what medicine they do, but in non-traditional healers, you just give them muscle relaxants or mild benzodiazepines, mild sedatives, then the muscles will relax and they'll stop doing it again. So this genital pain disorder, which is inability to have vaginal intercourse or penetration, and with the mass vaginal pain or pelvic pain, if not vulval pain during penetration, which is caused by anxiety about pain, is a reality. It is there. So before you become silly, one day a woman will get vaginismus when you are there, and then the whole community will know about it. Some of substances, which are the substances that are abused, they can cause some sexual dysfunction. In some medicine can make adequate lubrication in a woman or cause impotence in a man, and clinically significant orgasm delay, and it can interfere with the relationship. Total anorgasmia, I've said, are people who will never experience orgasm in their life. And impotence is inability to attain erection sufficiency of sufficient stiffness to penetrate in more than 75% of times. That's what psychiatrists say. It's not always, but majority of time is important. But this you must define very clearly. If it's at the advanced age, 70, 75, that can be impotence. That's age-related, because as you age, the tonicity or stiffness of the penis is also become more flaccid. So is premature ejaculation, which I've already said that is in relation to the partner's response. Etiology, what causes sexual dysfunctions? Psychiatrists and psychologists and sex therapists know far much better than this. The Masters and Johnson described in two-time models. There are immediate causes and distant causes, which immediate causes can be performance, fear of performance, where a woman adopt a spectator role in sex. It's not good to adopt a spectator roles. In sex, there must be participation for both sides. And distant historical causes are socio-cultural and biological causes and things like sexual trauma. And some people who are hidden homosexual inclination. I'm not sure that just got homosexual, but there's some hidden homosexual inclination. So sexual inadequacy can be caused by many things, from rape, sexual abuse, guilt about sex, religions about religion, homosexuality, lack of knowledge about sex. People should have knowledge about it. They don't talk about it. Even in a church, I haven't had in a church people preaching about sex. People don't know about it. They just know how to discourage, but they don't know what they're discouraging. Must teach it and talk about it casually. Alcohol and tobacco also can affect women's sexuality very negatively, physiologically, but socio-cultural issues are also there. They are good because sometimes they can enhance sex, sometimes they can diminish sex. For you to have a good sexual life, you need to have their physiological effect. You must eat well and have a healthy, and must have attraction towards that partner. You can't have good sex with a partner you're not attracted to. The attitude toward the partner is very important. Positive attitude. You can't hate someone that you hate. The physical factor you must assess as a good nutrition, good health, and have a good sexual experience, good sexual knowledge, which are social and sexual history factors. The things that make you to have a poor sexual functioning is things like psychological depression and anxiety disorders, if performance fears, if sex is just too much routine, or poor self-esteem, you're not confident in bed, uncomfortable environment for sex, you're having sex in where you think people will come and see you, a narrow attitude towards sex and negative thoughts about sex, and other things that diseases and drugs that can affect sex. But social factors that like rape and sexual abuse. That's why people who have been sexually abused and raped, they need a good therapy. They must be debriefed thoroughly, otherwise they'll have problem even in their future relationship and have sexual problems. The treatment of sexual dysfunction, I said, I'm not going to touch it because it's diverse and it's not one line. I leave that to expert. If you've got sexual dysfunction, see expert, see psychologists, see sex therapy. Psychologists, not everybody. Those who are specializing in sex therapy, if they think it needs some medication, they'll call their friend psychiatrist, and you can be. Let's go to other entity, which in this entity is a clinical entities. There are 8 of them. They are called paraphilias. What are the paraphilias? Which are recurrent atypical sexual desire. Sexual desire which is bizarre, is atypical, or sexual urges which involve both physiological and sexual needs. Paraphilia is a recurrent sexual attraction to unusual objects or sexual activity. You are attracted to things that people usually get attracted to them. They used to call them sexual deviance or sexual perversion in older terms, but now they're called paraphilias. Para means deviation. Philia means attracted to. You are attracted to people, things that people are not attracted to. Like, for example, transvestic behavior, cross-dressing for sexual gratification. For you to gratify your sexual desire, you cross-dress. Somebody put on a man will put on a panty to satisfy a sexual desire. And if he puts on a panty, he will go through all the steps of sexual response cycle, excitement plateau, and even reach a climax and resolution. All process as if he's making that, because he's dressed something that will do that. Most men use panties, and really marked by distress or sin with an unconsenting person. It doesn't bother them much. The categories based on the cause of arousal are 2. If you have got sexual attraction to inanimate objects, things that are not alive, and others are sexual attraction to children, pedophile, people who are attracted to children, is part of paraphilic disorder. It's not a acceptable sexual behavior. It's paraphilic. That thing needs psychiatric treatment. That person is not normal in the head. It needs psychiatric intervention and psychological intervention. They are usually the great ones are this one, fetishistic disorder. These people are attracted to inanimate objects that are not alive. Transvestic disorder, as I've said, is people who satisfy their sexual urge by putting opposite sex dresses. A woman will put on trousers and other things, and men will put on dresses and female things to satisfy their sexual urges. Paraphilic disorders are the pedophiles, because pedophiles are divided into two: those who are attracted to pubertal girls and those who are attracted to children less than pubertal girls, because the paraphilic disorders are attracted to girls around puberty when they start having breast and other things. But the true pedophiles are attracted even to infants and small children. Voyeuristic disorder is a disorder that a person satisfies his sexual desire by watching unsuspecting or people making love, or watching people undressed or having sex. We call them peeping toms. If they see that, they get attracted, they get satisfied. And there's another one, which is when we don't discuss them all and see how it affects us. Exhibitionist is somebody who exposes his genitals to an unwilling stranger. It's just a stranger and expose the genitals. That satisfies his own ego and sexual desire. Frotteuristic disorder is sexual touching of an unsuspecting person. You touch a person, you come nose in a crowded situation, you touch that person maybe on the buttocks, and the penis touches the buttocks, then you get satisfied. That's a frotteuristic disorder. It's a psychiatric disorder. So is sexual sadism, which they said is somebody who inflicts pain. By inflicting pain on others, you satisfy your sexual urge. Masochism is somebody whose sexual urge is satisfied by receiving pain. I'll describe masochism later. Etiology of paraphilia is complex. There's neurobiological factor and classical conditioning factor, which are psychological. Neurobiological is usually neurological. There's some internal androgens and endorphins that get involved. And psychologically, they say there's operant conditioning, training that you can train to be a paraphilia. A history of childhood physical and sexual abuse, they say it can cause paraphilia, but it's still debatable. Alcohol and negative effect are common triggers, and some form of cognitive distortion inside. It's very complex etiology. I will not go into it. Let's go into fetishistic disorder. DSM-3 says if for 6 months there is this recurrent and intense sexually arousing fantasy or urge or behavior involving the use of non-living object or non-genital body parts, it's fetishistic. Non-living object, I mean things like a shoe. Some people can be satisfied like a shoe, stockings, as I said, underwear, say males use female underwear, or a female using male underwear. It can be rubber garments. Sexual arousing objects are not limited to articles used in cross-dressing or device used for provide tactile stimuli. Whatever I say here, I mean to say for a fetishist, for you to be a fetishist, things like sexually arousing objects, things like dolly and vibrators that are used by women are not, that does not make you a fetishist, because these are things that are used in the market for women to satisfy their sexual desires because there's no partner to satisfy. So these things look like penises, they vibrate, they are vibrators, then they can reach orgasm with them. But if you use this, a woman who uses this is not a fetishist. So you must, when they say non-inanimate objects, they mean all other objects except objects that are used to have sex in the market, like the dolly and vibrators. So don't think that if you're using vibrators or dolly, you're a fetishist. You don't have any problem. This can be used by any other person. Paraphilic. Pedo means child. Hebe means puberty, pubescent girl. Philia means attraction. These people are attracted to children and pubertal girl. there's got this sexually arousing or urge or fantasy or behavior involving contact with prepubertal girls and pubertal children. The offenders are usually at least 16 years or young or 5 years younger than the victim. Usually child pornography is one of the things that triggers that or it replaces that. They act on this edge, they've got no control on it. The victim usually in pedophilia is usually known to the pedophile. It's either uncle or neighbor or anybody because he can lure the child or a family member or a friend. Most pedophiles do not involve violence. They use all other techniques to lure the child into sexual activity. And it can happen for many years unobserved, maybe until the child becomes pregnant. As I described, the type sexually attracted to pubescent girls, which general is pedophilic, and hebephilic is those with girls who are more. That's why you call pedohebephilic disorders. They say this disorder is the reason why men rape babies. Our lawyers will tell us, you know, if a man rapes a baby, which I described here, maybe he's a pedophile or is a pedohebephilic person, they just arrest and sentence. But for any disease, you not arrest a person, you observe that person. If you think he's got a mental disorder, it's a paraphilic disorder, you treat it and rehabilitate. But I don't know how they deal with them here. But what I know, when a man has raped a baby, the whole crowd, they say, deny him bail, he must go to, and the judge just punish him. But as opposed to what happens now, we know that...
Let's take you to Limpopo now, where the province has welcomed at least 50 babies since midnight. The new mothers, among them 5 teen mothers, welcomed 25 baby boys and 25 baby little girls. Last year, Limpopo recorded 253 babies on Christmas Day. This morning, Health MEC Popi Ramotruba is welcoming newborns at the Mankweng Hospital. Our reporter, Moloko Moloto, is there this morning. Hopefully, you've gotten an opportunity Let's take you to Limpopo now, where the province has welcomed at least 50 babies since midnight. The new mothers, among them 5 teen mothers, welcomed 25 baby boys. And
what he says is that in Limpopo, over the New Year and the Christmas, the MEC has visited that place at the hospitals, and of them, 14 of the people who give birth on one day were teen mothers. Teenage pregnancy is so common. But we say there's statutory rape, it must be arrested. But if a person of 9 years like this one has got a baby, is enough evidence that there has been sex. Why is a docket is not open to look for the offender if his offender is too much older than the baby and get arrested? They'll tell you that because nobody reported, nobody can investigate it. But as opposed to what we are going to discuss later, where bestiality, if a person can make love to or have sex with a goat or a sheep or a dog, that person can be sentenced without a dog having reported to the police or anything. This, I think, also things like this is evidence that there has been statutory rape. A docket should be open and investigation be done, and the arrester be brought to books, because this pedophilic disorder, which is characterized by recurring intense sexually arousing fantasies, it's so common. But if you find the offender, what do you do with him? Do you rehabilitate or do you sentence? Because now they say, they call our jails, they say they are correctional centers. I hope there's some psychotherapy there, but they don't correct it by punishment. But it's very difficult. I think Mr. Chidiwell must tell us, why is it not, if it's done, what can be done in this case? Another common of paraphilic disorder is what you call incest. And in blacks, I want you blacks to tell me whether you believe in incest. It's some type of pedohebephilic disorder. It can happen between brother and sister. Between relative, less common, but more pathological. Sometimes it can be between father and daughter. Incest is taboo almost in all other cultures. Genetically adaptive. It genetically, offspring of a father and daughter have got a chance of inheriting a disease. If there's a autosomal recessive disease, it likely to express if the two are so much related. That's why incest is not wanted. But there are a lot of things in the Bible. There are a lot of incidents where there are incest, you know. There are a lot of examples in the Bible. The common one is an example of Adam and Eve. Adam and Eve, for the generation to continue, their children had to make love with their own sisters because there was no other person. Abraham is the wife of Sarah. Abraham, the father to Isaac. Abraham and Sarah are brother and sister, but they are defined this way. Abraham's father and Sarah's father is the same man, but different mothers. Like in a polygamous relationship, same father, different mothers. Abraham and Sarah are like that. Actually, Sarah is Abraham's younger sister from another mother, is a sister from another mother. And that's contained in Genesis 20.12. Lot and his daughter. Lot and his daughter in Genesis 19. Moses, the father of Amram, who married his aunt Jochebed in Exodus 6:20. He married his aunt, her aunt, his aunt. And David, the son of Ammon, with his half-sister Tamar. Tamar is in Samuel 13, 2 Samuel 13. It is important to know, however, that the two above, which is Tamar and Lot, one of them was not a willing partner. It's a sort of you can call it abusive in modern terminology, but in African culture, you can call it forced marriage because they used to force marriage. Even in African culture now, they choose who must be married. And they usually choose a cousin. In an arranged marriage, you don't choose a stranger. You choose a person along the bloodline. That's why the diseases goes haywire. So that's a form of incest. So in Africa, we used to have a sort of semi-incest because ideally you must marry from your uncle's daughter. You must marry Amalumeagao. That's a sort of semi-incest because you share the same genes. You are likely to express the autosomally recessive gene like albinism very quickly if you marry a relative. But in the Bible, there are many. It's only this that incest was there in the Bible, and it was cherished upon. And we like doing things of the Bible. When I say we like doing things of the Bible, even if they are barbaric, we do them. I do a lot of. I'm a gynecologist. I do obstetrician. I do a lot of deliveries. You find women is delivering a male boy, a male infant. And he says, "Doctor, I want this child to be circumcised before I leave the hospital." I say, "Why?" He said, "No, I'm a Christian. You must be circumcised." No. You are not going to do a Jewish barbarism here. This child you can't subject this child to such trauma of circumcising very young. That's why I say we want to take everything in the Bible as gospel truth. So if we do that, we are likely to perpetuate incest. There are things that in the Bible that we shouldn't do them now. Let's go to another category, which is voyeuristic disorder, relating to or denoting sexual pleasure gained from watching other people naked or engage in sexual activities. Nowadays, it's easy for voyeuristic disorder to certify it because television's midnight. They show you all these things midnight. Porn movies, midnight, are shown. Previously, you have to go and peep through the keyhole and see if other people are making love to satisfy yourself, or you see people who are naked, you have to peep. But nowadays, the televisions, there are some channels, midnight, they satisfy voyeuristic disorders. And now again, the cell phones, you see children nowadays, every time when you see a child is watching a telephone, do you ever know what your child is watching then? You don't know, but he's watching, is liking that. And you wonder when a child doesn't marry, remains single forever, but all what he does, he likes watching cell phone because he's getting sexual gratification from watching a cell phone. From this age group, it will develop and mature I'm to this age group, and they say, why would this not marry? It will go to an age where all other males are married. For him to satisfy his sexual urges, he must watch other people naked or engaging in sexual activities. They'll even go to a stage where they don't have to marry anymore, because these smartphones, they favor heuristic sexual disorders. So I don't know the effect of these cell phones on the incidence and the prevalence of heuristic disorders. Psychologists and psychiatrists, they don't know it more. Maybe during their comment time, they'll tell us whether this thing, they've got a positive effect or negative effect, because people like it. When you go to the mall, you must go to area where there's a free Wi-Fi. You find all these teens, each one is watching his own telephone. Even in the family, you find that people are not talking, each one is watching his own telephone. What is he watching there? Do we ever really look what our children are watching? Maybe they will have these heuristic disorders. Another disorder which is sort of accepted is exhibitionistic disorder. Exhibitionist. Desire to obtain sexual gratification by exposing one's genitals to strangers. What do you mean by genitals? What are genitals? Genitals are sex organs, like penis and vagina. And there are other sex organs that are called secondary sex organs, like pubic hair, axillary hair, the breast. They are also sex organs. So if you expose your sex organs to strangers, you've got exhibitionistic disorder. The victims can be children or adults. Usually there's no physical contact, you just expose them. It can comorbid with heuristic disorder or phrotistic disorder. The common one that we see here and we have accepted is a woman exposing half of his breast to strangers, because this is a sex organ. Is this not a heuristic disorder, or is just fashion? We are living in the world of exhibitionistic. We are the community of exhibitionists, because this should all be covered. This is testified by the fact that if you read, when Adam and Eve, after they've eaten the Bible, the first thing they realized that they were naked. And when they covered themselves with the leaves, Adam covered, Eve also covered the breast. Adam may not cover the breast. Male breasts are not sexual organs, but female breasts are sexual. But when you move around in town and everywhere, you go around seeing secondary sex organs of women, and they're proud in showing other people their sex organs. Do they have an intense desire to obtain sexual gratification by exposing their sex organs to strangers? Maybe, maybe not. I think during the discussion, we must touch this and tell us that, is it acceptable or not? But in a black culture, you can't do like that. You can't do that, but it does happen, you know. Another common one, exhibitionistic disorder, is even made fashion with the trousers that are put nowadays. They say low cut. When you go around, you see the buttocks of many people. Many people, you can't go to a mall without seeing a buttock of a woman or a man, because the dressing is such that is exhibitionistic. It exhibit. More often, it's even fashionable to know all the underwears of a man. Many are aware. We find that an old, mature adult man with a trouser low down, you see the underwear, which sometimes not very clean, of course. You see an underwear, children seeing an underwear, mother-in-law seeing an underwear. That's really not culturally acceptable. I might be conservative, but I don't think it's something that you should show. There are certain people, you mustn't show something. Most people, if you are a woman, you really have to respect yourself. There are some things that you don't show. If you show them, I think you've got exhibitionistic disorder. Like men, trousers that are put this day, they call them tight trousers. They're slim fit. A man knows that his fat has got big time. He put a slim trouser and all things are dirty pattern, they're just hanging there. That's exhibitionism. Maybe you are satisfying your internal desire. And women has got this tendency of also putting tight things so that it just put everything on the permanent, people to see. And he's proud of that. Maybe that is exhibitionistic disorder. I don't know. It's so common. It's acceptable. It's there in the community. I think Memelepo, the psychologist, will tell us what do you think about this. I think it's exhibitionism. Frotteuristic disorder is also a disorder that's becoming fashionable. It's socially oriented touching of a person, whether consenting or non-consenting. It said non-consenting. Now I'm pushing it to a consenting person. The individual rubs his genitals against a woman's body and fondles her breast or genitals. It's frotteuristic. Often occur in crowded subways. Some people in the crowded way, they like to, it goes to an extent that he's going to touch a woman with the genitals, either the buttocks or anything, because it's overcrowded. But now I see it's legalized. I don't know where it comes from. People, when they greet each other, they do things like this. Up in this room, there's the genitals will touch other genitals there. Is that not a frotteuristic disorder? Dr. Mukwede? Is that not what I'm saying? This I think this is frotteuristic disorder. People can just get into one another like this, and you see the genitals are next to the genitals. This is not only a hug, but a hug also makes us feel closer to one another. But it also helps us to feel happier about ourselves in general. But in a disorder, frotteuristic disorder, a hug like this might arouse some feeling of hormonal stimulation and cause either erection or make a woman feels hot. So this should be regarded as a psychological disorder. I don't know where it comes from because it's not from Africa. Africans don't greet each other like that. We don't greet it, but they greet it. Even British don't do that. They take it from America. America, there's no culture. So the proper person of greeting a person, if it's a woman, why don't look at the face and shake hands? That looks normal. Or if you can, if it was my way, I would say greetings must be distance, social distancing. Your greeting. You mustn't come and rub against one another. And normal British greeting is like this. But in African greeting, you don't touch each other. You sit down, you say nda. You sit down, you say tobelang. You sit down, you say dumelang. Not a person being there, but because we think American barbarism is African civilization. When we greet such that we touch each other genital to genital. And that put us to be frotteuristic. That's a frotteuristic disorder. That's me who says so. Maybe Dr. Mugwena and Tabiseng will say, no, Mahabo, you're pushing it too fast. But I think for the sake of this education, stop that habit. Lastly, let's go to sexual sadism disorder. I said this is an intense recurrent desire to obtain sexual gratification by inflicting pain on another. It might be psychological pain or physical pain. These are people that are called sadists. And they are causes clinically significant pain, even to non-consenting person. They don't only do it to their partners. Even when he sees a woman, he can scold a woman, he gets satisfied. While masochist is a person who gets sexual desire by receiving pain. There are people who can satisfy their sexual desire by depriving themselves oxygen, asphyxiophilia. The person will close his nose for a long time until his lack oxygen, then he will get climax. That's a bizarre form of paraphilia. Other forms of paraphilia that are there, and there are offenses in South Africa as bestiality, which is a zoophilia. Sexual interest in lower animals. Lower animals, I don't mean animals like higher animals like elephant and lion. Lower animals like domestic animals, sheep, cat, chicken, goat, dog. They get attracted to those people. They are zoophilic. And others people are necrophilic. They are attracted to corpses. Let's discuss zoophilia first, bestiality. They are attracted to things like sheep, goat. And in South Africa, this is an offense. Bestiality is an offense in South Africa. Even if it doesn't involve sexual intercourse, you see this woman is kissing this dog in a very romantic way. So my question would be, if there's a sexual interest in animals, it's an offense, can be fined in court, can be arrested for that. But sexual pedophilia, statutory rape, where there's evidence of a child being born, is not investigated. For the reason that unless somebody reports it, it needs to be investigated. Nobody reported. In a bestiality, who reported this? Because the court never reported that, and it can't even go and testify in court. But they can take, I think the psychologists and legal people will take us through that, because this law is applied differently. Necrophilia, I said, they get attracted to corpses, not living person. There are a lot of cases that you find that a person is a serial killer of women. He have killed many women and raped them. They say he killed them and raped them. The question is he not a necrophilic person? The question is, because you find them dead, did he rape them first and kill them, or did he kill them first and rape them? Because if he's a necrophilic person with a psychological problem, he must kill them first and rape, because he's attracted to a corpse. He must make that person a corpse before he rapes. But they say serial killer, women are killed. We don't know exactly what is the sequence of necrophilia. And nothing is said about necrophilia in the Bible, mind you. Very little is said like this. Now I want to know, if it can be found that this person is a necrophile, or they call Travisan to come and testify in court, would you say a serial killer that we found? There are a lot in the radio that kill women, and women are dead and they've been raped during death. What happened first? This person, he rapes them and tries to conceal the evidence by killing them, or he kills them first so that they become corpse and satisfy his sexual desire from corpses because he likes corpse. I think I need a good legal view there. Paraphilia also, I'm not going to touch treatment. It's diverse and complex, and still research done, and it is insufficient. I'll leave that for experts to treat. If you find a paraphilic, don't go to an ordinary doctor, go to experts. The last category is not paraphilic. I must say this category that I'm discussing of sexuality is a normal sexuality, acceptable sexuality, not a disease, not a disorder, is homosexuality. There's a lot of homosexuality in the Bible. If you read Ephesians 5.3 or Corinthians 7.2, there it said, but because sexual immorality is so common, each man should have sexual relation with his own wife, and each woman should have sexual relation with his own husband. That's what the Bible tells us. And also in Corinthians 6.9, 1 Corinthians, do you know that the unrighteous will not inherit the kingdom of God? Do not be deceived, neither the immoral, nor idolaters, or adulterers, nor sexual perverts will see the kingdom of God. It's in Corinthians, even Leviticus, the beginning of the Bible, it says, thou shalt not lie with mankind as with womankind. It is abomination. That's when God was giving Moses or Aaron the laws that he must do. But as we say, Old Testament is old-fashioned, everything. They're not in New Testament, this thing. Nowadays, homosexuality is unacceptable, and in South Africa is allowed and should be treated as, if you are a law-abiding, you'll abide by what the country's law are like. But if you are not a law-abiding, of course, you must be arrested. You will not abide by that. This term gay primarily refers to homosexual male person or a trait of being homosexual. The term, I said, it means carefree. They're carefree, and they should be respected and treated as that. And if you treat them, ask them what they want to be treated like. If you say, treat me like a she, treat it like a she. He treats me like a he, treat it like a he. Understand it. The reason here is that we must try to understand this. It's new to us. It's not long that it has been allowed. We are not accustomed to it, but it is there. We're going to stay with it, with the homosexuality. It's a human rights, and sometimes human rights, Bible is about morality. Human rights versus morality. Which one will come first? It's an individual's choice. I'm not here to tell you. Maybe the clergies will tell us, or you choose. You obey the human rights, or you obey your morals or your instinct. Because this, I've said that in Leviticus, they say you shall not lie with a man as a woman. That is abomination. And in Samuel 1:26, they also talk about sexuality. You define the word sodomy. It's said to be the word sodomy comes from the Bible. It's a sin of Sodom, Sodom and Gomorrah. One of the biggest sins in Sodom is because there was anal intercourse and oral intercourse. Sodomy means anal intercourse or oral intercourse. So, but where do we draw the line? Oral intercourse is in two forms. There's cunnilingus, where a male is licking a female genitals. As there's fellatio, where a female is licking a male genital. Actually, it puts a male genital in the mouth like a stock sweets. That's called fellatio. Where do we draw the line? Because this fellatio and cunnilingus, which is part of sodomy, is described as sodomy, is practiced liberally as if it's part of the sex style. If you read about sex position, sex style, they'll tell you about fellatio or cunnilingus. But that's part of sodomy. Sodomy doesn't mean only anal intercourse, even oral intercourse, which means majority of people in marriage or outside marriage, they do sodomy because they do oral sex. They either do fellatio or they do cunnilingus. So sodomy is normalized and accepted. It also is part of sodomy. So don't talk bad about sodomy. It's normalized. So if we can normalize fellatio and cunnilingus, why not normalize anal intercourse? Because they all fall under the same way of Sodom, which is the sin of Sodom. You might, as long as you normalize this one, which is a fellatio, you normalize cunnilingus, you must normalize sodomy. You know, sometimes back, I was still a lecturer at Medunsa. I was teaching the fourth-year students. The lecture was on sexually transmitted disease. And I touched sodomy a little bit, and I touched the methods of transmitting sexually transmitted disease. And I referred to this anal and oral intercourse. This anal and oral intercourse, even legally, for the sake of Mr. Chidi, that sodomy refers to anal and oral intercourse. As explained in there's a case, Bass versus State. Sodomy defines any sexual act involving sex organs of one person and the mouth or anus of another. That's in the case law. Traditionally, sodomy has been referred to as crime against humanity by various courts. And what is sodomy according to the Bible? Is anal sex before or after marriage a sin? Is oral sex before or after marriage a sin? If sodomy is a sin, are married people who do oral sex sinful? Okay, this is what that's the question that I put, and I'm not answering them. The crowd will answer them, or they will discuss it during them. But I know majority of you are sodomists. You're doing sodomy in marriage or outside marriage. I'll give you the story that I had. I was teaching fourth-year students sexually transmitted diseases. Then I tell them about the method of transmitting sexually transmitted disease is oral sex, which is part of sodomy. And I was trying to discourage them to say that, look, oral sex is not good because you can get things like syphilitic chancre on the tongue. You find that the tongue has got a big ulcer there, which is called by syphilis. And then because it was introduced during oral sex, or you can have severe viral infection mixed with fungal infection that can even damage the vocal cords and change your voice and make your breath smell. And I saw one young lady, smaller than a girl, fourth-year student girl in Medunsa. She's shaking her head as I'm talking. My girl, what are you? Why are you shaking your head? She said, doctor, no, I don't agree with you. You don't agree with what I'm saying? Why? You should stop this habit. No, it's not possible. How is not possible? No, doctor. It's blowjob. I said, yes, blowjob is a good man. This is what even the Bible is against. It is sodomy, and being a sodomy, even if you look properly whether there are no disease or not, biblically is part of sodomy. If you practice sodomy, allow other sodomies. Sometimes you find a person has lost all the teeth, has got viral warts, which are genital warts in the mouth because she's got it from here. Now, there's a case, it is a true story, where a person who practiced sodomy was raping, and the only way of raping her, she liked practicing sodomy. And that sodomy is in the form of fellatio. He wants to put a penis inside the woman's mouth during a rape. And the woman, I'll open the mouth, but during that process, the woman amputated a man's things. Who is at guilty? We will say the woman is self-defense, but because this is GBH, it's grievous bodily harm. This is a case that was there in the journals where a woman got amputated because he was doing fellatio. So you men who were doing fellatio, but drop that, you don't anger that woman before you do fellatio. It will amputate you. There's a lot in the Bible. Ephesians 5 verse 3. It talks about that. It said, let there be no sexual immorality and impurity or greed among you. Such things have no place among God's people. Don't allow love to turn into lust. I describe what lust is. Setting off downhill side into sexual promiscuity, filthy practice of bullying greed. In Hebrew also, they say marriage should be honored by all. You must honor marriage. With this high rate of divorce, I don't think marriage is honored. And he said, marriage bed must be kept pure. It's not only in the Bible. Even in our culture, marriage bed must be kept pure. You know, the worst thing that you can ever do, which will shun upon, is if a man sleeps with another woman in the bed, he sleeps with a woman there, or a woman brings another man to sleep in a bed where he sleeps with the husband. That's in our culture, it's a reason for divorce, it's a reason for separation. If you disrespect any partner, bring another partner into that bed. You can rather go somewhere, you can be forgiven, but you can't bring it. That's why marriage must be kept pure. And that's also in the Bible, in Hebrew 13.4. So I think the Bible and our culture, they somewhere come together. So oral sex as a term or a specific practice does not appear explicitly in the Bible. All the verses that they talk about oral sex is by implication. They interpreted it might mean oral sex, but it's not directly saying oral sex. And if you imply something that implies like that, many people can interpret it very differently. Like then Proverbs 30.2 to 20, verse 20, he said, that is the way of an adulterous woman. She eats and wipe her mouth and say, I've done nothing. You know, that's like a idiomatic expression. But people say it means, when they say she eats, it means it's fellatio. It doesn't mean that. I don't think it means that. I don't want to be direct, but I don't think it can mean many things. Female homosexuality. A woman who is physically and romantically attracted to other women. In the Bible, little of none is said about that. None is said about that. Lesbianism, which is derived from the Greek poet I said who called Seppo, who lived in the island of Lesbos, is not taught in the Bible, but is practiced. But it's very difficult to spot it because women, it's not uncommon for women to sit like this, to sleep like this, just be friends like this. I was one day working in a bookstore. I like going to the bookstore and read the books. I see another Bible. I say, I have to buy this Bible. It said, lesbian sex Bible. When I read inside, I found that it's a Bible, of course, because people say it's a Bible. The Bible means collection of booklets. But it was talking about all the sex styles of lesbians and how romantic it is, which impressed me, of course. That's why I respect lesbians. And today here, today I've got one of my friends lesbian. I'm very friendly to lesbian as a gynecologist. I treat many lesbians. Today here we've got one of my friends lesbian. I won't mention his name, but I was with her today. And that lesbian is pregnant. She said she's going to lock in. And I think during comment, She must just come in and say, I'm that friend lesbian. So you must know his name and tell us. He educated me more about lesbian. I don't have many friend gays because as a gynecologist, I don't treat them. I wish I could have friend gays. I respect them. I love them very much. The treatment of paraphilias, of course, the doctors and psychologists would see them. But incarceration and court order, which are common, Mr. Shiji, me being a doctor, I think is not the best treatment for paraphilias. Maybe there's another way. The treatment modalities are variant, the outcomes are different. And I think even if they're treated, dropout rates are high. I think that's how little I wanted to talk this about. It's a wide topic. I will not finish talking about it. Our panel, I'll remind you of our panels, who they are, and tell you the sequence in which they recommend. I'll request them just to pass a comment without being asked a question about the topic as a whole, not necessarily answering any particular question, just to educate us about what he thinks he can educate us, can add or subtract, or emphasize on what I've said. I said they are Ntabiseng Ramotwala, clinical psychologist. He will be the first one to talk, followed by Dr. Pule Molepo and Reverend Makoti. Muruti Patak is replaced by Muruti Hafel, then Muruti Hafel. Then Matumi Chidi will be the last one as a legal person. Thank you very much. Let me make you unmute you so that you can unmute yourself. Okay, now you can, I think I've unmuted you. I'm trying to unmute you. Okay, you can unmute yourself. Can you unmute yourself?
We can.
Yeah, now,
Yes,
Ntabiseng, what can
Yes,
you
doctor.
say? Ntabiseng is a clinical psychologist. Just briefly talk about, tell the participants about this before they ask questions. After the panelists commented, you can ask questions and answers. They will answer the questions. Ntabiseng, are you
thank
there?
you. Yes, I'm here. Can you hear me?
We can hear you, but darling. That's Ntabiseng
Okay.
Ramoswala. Is a clinical psychologist in Pretoria.
Thank you so much, Dr. Mahapa. Thank you for the invite and good evening, everybody. I actually was listening and thinking, you said a mouthful. You said everything that I am supposed to say. And all I want to say was to say is going to just add on everything that you said. But in terms of the disorders and dysfunctions, we actually touched on them adequately. My opening statement would be like to say, I think sex is a beautiful thing. Sex was created for people to enjoy. Sex cannot be used as a weapon. However, it is generally used as a weapon. And that's why sex becomes a psychological issue when it is not appropriately used. Sex is an innate behavior, is something that we are born with. It's a need for most of it's a need for the majority of people, and primarily it's a need for men. I read a book by Dr. Miles Monroe at some point, who defined sex for men as sex is an oxygen. So when you said people think about sex most of the time, and people think about sex, but doesn't mean they do it. I actually was reminded of that he said sex like oxygen to men. And when men have sex, it is always distorted by people who hence we have sexual dysfunctions, hence we have sexual disorders. The difference between sexual dysfunctions and sexual disorders is when you want to have sex or you want to enjoy it, and you have some medical disorders that makes it impossible for you to enjoy it. And sexual disorders is all the disorders that you've mentioned earlier on.
No, I missed.
What?
You know, when I do, it's the
Sorry,
same as doing
everybody,
Okay.
some people, please mute yourselves.
properly.
Mute yourselves, please, and allow Nthabiseni to finish.
But we're still leaving the door open. This is what Musaki Shankar Makuna Natwaka. You must close the door. Open a Makuna Nachua.
This Melissa is making noise.
Now, please, people, let's allow Nthabiseni to talk. Nthabiseni, are you still there? Let me see. Nthabiseni, unmute yourself and you can talk. No, I've lost Nthabiseni.
Can you hear me?
Yeah, I can hear you, sure.
Okay, all right. And hence we have sexual disorders and paraphilias, as she has explained. What I want to touch on is that most of the things that you've mentioned have a psychological base to them. You'll find that people who experience sexual dysfunctions, for instance, you mentioned things like early premature ejaculation or late ejaculation, that come because of sexual, because of psychological disorders. Because a person is anxious about performance, they will ejaculate early. And because they have marital problems or financial problems or any other psychosocial problems, it affects their sexual performance. And most of the time, people are not aware of the relationship between the two. They try to deal with sexual disorders or sexual dysfunction separately from their being. Unfortunately, psychological being is part of our total well-being. So if you don't treat our well-being and psychological well-being together and effectively, it will affect our sexual performance. And looking at different paraphilic disorders that you've mentioned, there also has a psychological base to them. For instance, exhibitionist disorder, where a person would like to exhibit their private parts to or genitals to other people. The shocking effect that it has on a person who sees the exhibitionist brings psychological pleasure to the person who's doing it. And that's basically a sense of happiness and a sense of excitement for the person. The same as voyeuristic person who peeps, what you mentioned earlier on, that people that we call peeping Johns, they enjoy, they get to be excited about it, they get to get aroused by it, and therefore they would do it over and over again. So everything is about psychological disorder involved. And you find that we have sexual sadism disorder, where people are involving in extreme pain and suffering or humiliation of another person. With that one, we have a very typical example that we can make. I know most of us have read the book, and some of us have seen the movie, 50 Shades of Grey. It demonstrates sadism and masochism very clearly, where the participants actually offer sexual pleasure through pain. I don't know how people can enjoy sex through pain, but they do. You know, they want to be whipped with shambox. They want to be beaten on their nipples. They want to be bent somehow in order for them to have sexual pleasure. So these things do happen, and these things are there. And we can't actually treat them that they don't exist. They exist. Just to go over that, I would say psychological disorders that end up having an impact on your sexual performance can start off from depression, when you have depressive mood in yourself, your emotions, mood disorders, when you are anxious, when you're extremely stressed by anything. Can be stressed because of finance, it can be stressed because of relationship, it can be work stress. You find it happens most of the time. Couples come in for therapy because there's no longer a bedroom dance, because the husband is going to be retrenched or he is retrenched. And we've seen that particularly in the past 3 years when we went through COVID and a lot of people were retrenched and a lot of people were laid off and a lot of people lost their jobs. It also affected their sexual performances. However, on the other flip side of the coin is that you find people who actually use sex as a comforter, who go through all those problems, and then instead of withdrawing from sex, they actually have more of it. And hence, you found that a lot of people fell pregnant. So towards the end of COVID, we had a lot of women who were pregnant because their husbands or they themselves were laid off from work and they were not doing anything at home. Or the only thing that could comfort them was sex. So when you think about sex and sexual disorders, it's all about what is happening in your mind. And hence, when a person comes in to therapy and discloses that they have a sexual problem, you know that sex is something that happens between your ears. It starts between your ears. It doesn't start anywhere else, but it starts in your head. Doctor, you mentioned as well that, just to add on what you said about sexual impressions, the society has defined sex for us, which means sex was defined as something that can be had between a married woman and a married man, a couple that is married. However, through different dispensations, we find that at this point we are going through what we can call sexual revolution. I know early in the 1800s, we went through sexual revolution as well. But now we are going through it where people are half dressed, half naked. People are showing their parts, as you showed that other woman who has big breasts. Women are walking around without wearing underwear. Men are walking around with skinny jeans and showing their underwear. It simply shows we are going through a sexual revolution, and we are normalizing what our culture has normally said. It is not normal. We can't expose our body parts to everyone to see. However, being sexy is about showing a little bit of more flesh now of late. So when you are in practice and you're seeing younger people who are 40 and lower, they will actually come into practice and tell you that I was wearing such a skirt and this guy wanted to rape me. They don't see it as anything wrong. And when you look at them, and the legal guy will also tell you that when you look at them, you will think, but if you had dressed up properly in a manner that is responsible, you may have avoided being raped. No, it's not seen like that. Another thing that actually adds to sexual revolution that I'm talking about is the dating scene that is happening now of late. You find that most women go out to nightclubs, to restaurants, everywhere else, where they know that they will be picked by men. And as they are picked by men, there is no that thing that used to happen in our time where a man would actually court a woman for some weeks and even some months before they get that agreement to say, you and I are in a relationship. It happens through dating. They go to a restaurant the first time, the second time, the third time, those people are in a relationship. And because they're in a relationship, they now start interacting sexually. However, that respect for opposite sex. So generally, as you go out there, the landscape has changed and the view and the opinion about sex has changed. So you and us and other people above 50 now of late, Dr. Mahapa, are seen as, what are these things? Dinosaurs, because you don't understand the sexual dynamics that is taking place right now. I heard you mentioning things like Sodom and Gomorrah, and that most of the things are seen as sins of Sodom. But now it's something that has to be seen that as something that needs to be done. If a man is not performing fellatio or performing oral sex, a woman will see that man as boring. Same as a man who is with a woman who's not very welcoming to doing those things is seen as boring. Hence, we find in our psychological therapy rooms, we get a couple that is divorcing because a man feels that my woman is very primitive. My woman is not open. My woman is not open to new things. And therefore, that is why I am cheating. That is why I'm having extramarital affairs, because I get excitement out there. So it's a whole lot of things, a whole lot of layers that is causing a dynamic of different sexual disorders, as we may label them. However, because of what is happening at this point, we have all normalized it. Take it in our country, for instance. South Africa has normalized things like lesbianism, gay relationships, any other relationship that in the past were seen as not normal. So unfortunately, our world is turning to a point where we are normalizing things that could actually in the past protect us from sexual immorality. So all I can say looking at this is to say, let's approach sexuality with a liberal mind. Let's approach sexuality remembering that we all come from different backgrounds. And let's approach sexuality remembering that laws are made to protect us, and laws are made to protect victims of sexual violence. But that doesn't mean all of us have to be judges in terms of what happens. All we can do is to support people who go through it. And I like what you said when you said a lot of rapists get, but they're not understood in terms of what happened when they did that. The question that you posed earlier on, that if a person rapes a corpse, for instance, and I am called to testify, how will I know whether he raped the corpse because before the person died, or whether he raped and killed, or killed and raped? That's a question that I cannot answer, but the person themselves. But I know usually when a person rapes a person and kills them, it's sometimes out of the excitement of seeing the fear on the face. And normally that's what happens with most rapists. When you find a person that is a serial rapist, they become serial rapists because of psychological disorder, of enjoying the fear and the pain that a person experiences as they are scared of being raped. And that actually encourages them to rape more. So if we can actually go more into treating rapists as well, as much as we treat people who have been raped, maybe we can make a difference in our society without just punishing them and putting them into jail. The other important part that you also mentioned that I want to add on, it's about routine that may come into our sexual lives. Most couples find themselves getting bored with sex, especially those who are married, because they end up doing the same thing every day. They can actually tell you without blinking an eye what is going to happen in bed. And they don't even bring excitement. And sometimes when you are married to someone who is rigid in their thoughts, whether a man and a woman or a woman comes up with new things, and the man will say, where did you learn those things? Or a man comes up with new things, and the woman will say, how? Are you now playing around Libo Pussy, Libo Ntabise, now you want to teach me those things? So if we can also be open as couples and treat each other with trust, we can be able to learn what is happening in terms of our sexuality. We can also learn what can make us enjoy sex. We can also learn how to pleasure our partners. However, that is that I can leave to individual couples, because it is that we are all guided by our society, we are guided by our religion. People who believe in religion won't do certain things. We are guided by our liberal minds. We are guided by our medical professions as well, knowing what is dangerous and what is not dangerous, knowing how to keep ourselves safe and what is not safe, and knowing that if you have sex with multiple couples, what you need to do to protect all of them, not really protect yourself, but to protect all of them as you are doing that. Maybe just to avoid talking longer, I will leave it there for now. But
Thank you
Doctor,
very much, Tabitha. Thank you very much. You have said a mouthful. You talk like a real psychologist. Tabitha Ramaswara is a psychologist in Pretoria. He's not talking from here. I'm from Pretoria. Let's hear from the head of the Department of Psychiatry in the University of Limpopo, Dr. Mokoena Puleng. Dr. Puleng, how are you?
I'm fine with you, Dr. Mahapa, and good evening to all the colleagues. Thank you very much, Dr. Mahapa, for a very comprehensive presentation. And I think the additional comments by Ntabi Singh supplemented what you presented. Your presentation was very holistic. I think you covered all aspects, and coming from a psychiatrist, I think you covered the paraphilias very well. I just have a few comments. Sexuality is a subject most healthcare professionals are very uncomfortable with. And I think by us as healthcare professionals, getting outside that cocoon and being able to address sexuality matters with our patients, they will feel more comfortable and be more forthcoming with information. We miss a lot of problems amongst our patients by not taking comprehensive history, not only for psychiatric issues, but even for medical issues. From a psychiatric point of view, a person with depression may present with sexual dysfunction, and the medications that we prescribe for them, like your SSRIs, may lead to sexual dysfunctions. And when we follow up on these patients, we seldom explore that aspect of their treatment. You just, on a general basis, just ask about side effects and so forth. But the real problem that this person may be concerned about will not be addressed, and suddenly they stop taking medication and so forth. Sometimes it's also coming, going on to medical conditions. The medications that we may be prescribing for other medical problems may be leading to sexual dysfunctions. So I think if we can learn to take proper history and explore issues comfortably with our patients, would solve a whole lot of problems. Dr. Mahapa talked about the health-seeking behavior of women with regard to sexual matters when you compare them to men. Unfortunately, it's not only with regard to sexual matters. Women are better at seeking advice or attention for medical problems than men. So we need to also attend to that, because by the time they present, sometimes even for other medical problems, it may be too late. Dr. Mahapa said a mouthful with regard to the paraphilias, and you asked the question with regard to the hugging and the showing of cleavage or whatever, whether it shouldn't be considered as, and showing of underwears also, it shouldn't be considered as paraphilias. One aspect, in terms of the DSM-5, one component of the criteria for paraphilias is the intense sexual arousal. So unfortunately, Dr. Mahapa, the underwear that's showing inappropriately, the low hanging trousers, the cleavage, it doesn't qualify that as paraphilias, including the hugging. But we should remember that there's hugging and there's also hugging that would make somebody uncomfortable. We have a responsibility. I think that's my last comment. We have a responsibility with regard to statutory rape. and we see them all the time. We see them delivering. I think the MEC of Health, Dr. Ramatubari, even recently raised a concern, and probably another MEC from another province raised a concern about adolescents less than 15 delivering babies. As healthcare workers, we cannot just turn a blind eye. We still have a responsibility, because there are rules that apply to even the age of the father. There shouldn't be a 2-year gap or more between the father and the adolescent, because there was a concern raised a few years back about criminalizing sexual interaction between adolescents. But we see a whole lot of them, and I think that needs to be explored, because most of them are actually statutory rape cases. But thank you very much, Dr. Mahapa, and I think people should feel comfortable with regard to addressing sexuality. Thank you.
Thank you very much, Puleng. Dr. Puleng Mukwena is the head of department, a psychiatrist. This is from a psychiatrist. I said in my introduction, I'm just a gynecologist. I don't know much about it. These are the people that deal with them that know much more than me about it. I was just a person. Thank you very much for that comment, Puleng. Let's go to the spiritual part of this topic. You've got two reverends here. One reverend is a medical doctor, a friend of mine from high school. He's also a reverend.
Good evening.
Majaji Makoti. Let me talk about you, Minia. I'm talking about you. Me and Makoti, we knew each other. We've been friends from Form 3. We schooled here in Zishio, and then even at the university we were together. And I once worked for him, you know. I did a locum for him before I could specialize. So he's a general practitioner in Tembisa. He's living in Pretoria. I'm here in Polokwane. Many are Magoti. Greet the participants and let's hear your view. He's also a reverend with Bachelor of Theology.
Thank you, Menier, and greetings to everybody, all the participants. And it is a very, very good topic, very difficult topic, but thank you for your presentation, preparation, and the way you said everything. You actually said a mouthful, and it taught us a lot. And it taught me the other side of sexual dysfunction and sexuality. And I am quite happy about this. And unfortunately, this is not what we normally preach about in our churches. So I'm going to be a little bit controversial here. And though I'll be a scriptural. When God created man and woman, and he said that they should go and multiply and fill the earth, and he gave them the right to rule over everything. And it was the choice, the man's choice. It was the woman who came with it, but man allowed it to happen. That is the reason why God had to say they must leave the Garden of Eden. But now, what I want to say is that when we can read, allow me to read Galatians. I'll be quick. Galatians chapter 3, verse 28 and 29. I'll just be very quick. The reason why I read this is because some people, when they do homosexuality, they just quote this verse and think that what they're saying is correct. He said that there is neither Jew nor Greek, slave nor free, male nor female, for you are all one in Christ Jesus. So people say this because they want to follow homosexuality, and they base, especially in the churches, they base their arguments on this, that the Bible says that there is no male nor female. But we know in the beginning God created male and female. But when the people read this verse, they tend to distort the meaning of the verse. The meaning of the verse is not that. It's just that we are one in Christ. That is, everything that we do, we follow Christ and we are one in Christ. But God gave us the right to choose. And then when you read Matthew chapter 19, verse 8, the Bible says that in the beginning it was not so. In other words, in the beginning, God created man for a specific purpose with specific sexuality, and a woman with the same thing. But the Bible says that Moses allowed you guys to divorce or to go the other side because of the stubbornness of our hearts. And even the way we follow it right now, it is the stubbornness of our hearts. If you can tell people that a man cannot sleep with men, they will stubbornly fight with you and quote some of the verses which they quote according to what they want. But the Bible says that God created man and woman. And then when we continue, we realize that homosexuality has been there even in the beginning. You know, when you think of Lot in Genesis chapter 19, from verse 1 to verse 38, when the two angels came to warn Lot about, that is the Sodom and Gomorrah, about this, the people then knocked at Lot's house and said that, where are the men who came to visit you? Bring them out so that we can have sex with them. The people who were saying this were not females, but they were males who wanted to have sex with other males. So you can see that, and even here it says, even the young ones, the young men were there. So people were teaching even the young people how to become homosexual. So it was a disease that was there even in the beginning. But we cannot say just because this was there in the beginning, then we practice it. No, we must practice what the Word of God says. And the anatomy, God created man anatomically to be a man. God created the penis to be the penis. And he created the vagina to be what it's supposed to be. And you can see that God created some of the cells or organs or the nerves in the vagina, so that when you penetrate, you feel a different feelings. You feel a different feeling and the enjoyment. So I don't think that the same feelings, the same nerves that are there in the vagina are there in the anus. So I don't think that homosexuality is correct. You have said a lot to Menier. That's how I call him. I call him Menier. You have said a lot about this, and sometimes I used to ask myself, when I see some people singing in church, well, what is important? Is it the genotype or the phenotype? And if we say the genotype, what is the problem with this? Did God create them like that? Or was it some mutation or something that happened that made them to decide to behave like female, or that made females to behave like men? But I still believe that it is wrong, because down the line, some men who are homosexual or who are gays change their lives and come back to normal life. So allow me to say it is a matter of choice. As it is said that in the beginning it was not so, but because of the stubbornness of our hearts, Moses allowed it to happen. I think I can stop there, Menier. Thank you very much.
Thank you very much, Menier. I don't see Reverend Hafela here. I don't know, maybe his phone he doesn't, but I want to break a monotony. I told you that I'm a gynecologist. I deal with most lesbian. I've got lesbian friends. And I asked one of my lesbian friends, patients, who is presently present, and I can see her here. I said, we're not going to mention her name. We're just going to greet you and maybe educate you and show that lesbians are also part of us. I'll ask her to unmute and just greet, and maybe if he wants to comment, but he won't say a name. Can you hear me?
Yes, Doctor, I can hear you.
Yeah, just greet the participants. We've got about 120 participants. And my friend, she's pregnant, she's attending with me.
Yes. Let me just greet everybody else with respect. Yeah, well, I won't say my name, but I'm your patient, and I'm pregnant, and it's going well. Well, many people tend to
Talking to the phone. Talking to the phone, you have disappeared. Okay, maybe we'll come back to him. Let's ask. He is muted. Let me try to unmute him. Can you hear me, my friend? She can't hear me. Okay, let's go. We'll come back to you with later technologies. Is Reverend Khafela here? If she's here, may he please unmute and speak. She's not here. She was at the funeral at Sishiro. Probably she's still at Sishiro. She didn't manage to join us. Thanks, we had Reverend Makuti. Dada Chidi is a lawyer. Dada Chidi, I saw him. The guy was the one.
Ronald guy, many years.
Dada Chidi is an attorney.
Yes. Does he
What's your
shoot?
comment about all this and from the legal point of view?
And it's a very, very interesting topic because it's grounded in religion, culture, medicine, as well as the law. And one of the concerns raised by Dr. Mahapa is that if we don't regulate some of the things, at some stage we may have sex in public like animals. For sure, somebody who lived 60 years ago would not have believed that would be where we are today. And that comment may come to be a reality in 30 years' time, in 40 years' time. And I say this because there is also a move by government to introduce it's already a white paper, it's a policy that proposes a law, polyandry. Polyandry, it's a marriage system in terms of which a woman marries two men. So it's a position of government. They're saying, can this be discussed? And at a later stage, it may become the law. Well, the reason why it's done is as follows. If a man who marries customarily can have two wives, why not a woman who may marry two men? And that's the argument that is advanced. So what it does, it attacks an African institution which is grounded in culture, in people's heritage. That's what it does. But purportedly, it's supported by Section 9 of the Constitution of the country, which guarantees the right to equality. So what applies to a man would, in the logic of those who want to introduce the policy, should also apply to a woman. So my take of it is that it's something that should not be allowed to stand unless a society were to vigorously discuss that issue and come to agree that perhaps it's necessary. But the manner in which it has been introduced, as has been the case with many other sets of law, in my view, it's inappropriate. So I was just trying to emphasize what Dr. Mahapa indicated, that in years to come, we should not be surprised when in public you see people engaging in sexual intercourse. I mean, if you talk about the law, for instance, and still on the topic, we train those who in the work I do, those who are going to be attorneys in future, and some of them would be pretty young ladies, and this is in line with what was discussed here, displaying your body parts, and they come to work with cleavage out, and you are sitting with this young lady, and you are looking at her, and your mind, like any other human being's mind, functions. So what I usually do, I come out very openly. Look, I am a man, and when you come to work wearing like that, you cause a problem to me. But I believe also to my clients and to other people's clients in the office, and to members of the public, and we are associated with our firm. So I would sit them nicely and advise them, try, and you should succeed at the end as much as you can to cover your essential parts of your body, not only for this firm, but elsewhere as well. But here, because that's where I can advise you most, try to cover your body. So that you reduce this trend that is becoming something that, seems to be acceptable, exhibiting body parts. And some people do it not because they derive any joy sexually from it, but because perhaps it's a trend. And some are innocent, innocuous about it and do not intend to derive any joy whatsoever. But then if it becomes a trend, it would be harmful to many others psychologically. I think those who are on the platform, the experts as well as respondents, would advise us best on that aspect. But again, as well, you avoid incidents of sexual harassment, where a director and manager in a firm, in an entity, later on is accused of engaging in inappropriate conduct. Of course, what is central in the whole presentation, insofar as the law is concerned, from Dr. Mahapa's topic and his engagement of the members of the public, is whether a person who has a mental disorder or mental illness may be held liable criminally if engaged in conduct which ordinarily they could be held criminally liable. And I was invited to comment on that. I'm going to do that, I think, within a minute or so, because it's a bit late. There are only two distinctions. At the time of committal of the offense, at the time, for instance, of what a sexual offense, rape, if at the time when somebody committed the offense, the person had a mental disorder of any nature, which would have inhibited this person from applying their mind properly to not engaging in the conduct, the said person, because the focus is what happened when the offense occurred, the said person will not be found guilty. Because the inquiry would be whether this person at the time when the incident occurred could have desisted from this conduct. And if no, then the person will not be found guilty to have committed an offense of rape, as a way of example. And still on rape, let me conclude on this point. And there's a finding perhaps from a court of law that this person suffered mental illness during the proceedings. So the second scenario would be at the time when it occurred, this person could understand fully what they were doing, and they knew what they were doing, and all of that. But perhaps there's an intervening activity that causes mental illness between the time of the committal of the offense and the time when this person should be tried in a court of law. And at the stage when the person is tried in the court of law, it is found that the person is not fit to stand trial because of mental disorder. At that stage, the proceedings will not go further because this person cannot be tried. But the evidence may be led to show that indeed it happened, and the person is committed to an institution, and if they are healed, they may be called and come and account fully. But at the time when it is found during trial that the person does not understand the proceedings, you cannot try that particular person because the person does not have the capacity to be tried. That is my small contribution, Dr. Mahab. I see it's a little bit late.
Thank you. That was quite from a legal man. I said this topic. I like it when you talked about polyandry. I didn't talk about it. I deal with women. They tell me already these days if a woman loves a man, I'm afraid. Is that true? Where I come from, that will stop the rain from raining. But if with polyandry, I don't know. It's liberalism. I can't comment on that. The previous people. Now I leave it to the crowd. Reverend Kafala is not here. Everybody, participants, any questions and anything, if you direct it to a particular expert, direct it. If you just put it in the air, everybody can pick it up. I see my friend here, Dr. Mtlanti, usually like to open the can of worms. Snuzola, how are you? What's your question or what your comment or subtraction or addition? And everybody's allowed now. Now it's free for all.
Thanks, Dr. Mahapa and the panelists. You know, this topic is very, very huge. And I think we'll have to maybe come up with further where we come with, you know, treatments, especially from the psychiatrist and the psychologist, where we'll come with the medical treatment, psychological treatment, and so on, psychotherapies and behavioral modifications. So I think that might be another topic for the future, because today we're talking about symptoms and their presentation. So from when I was listening to the whole topic, I did miss a few because I was a bit late. I think that sexuality is evolving, and they were not going to stop it. I'm an old man. I don't. I'm unhappy with a man who's showing his underwears and buttocks. I don't like those. But these things are happening. I mean, you had the first TV was black and white. Today, you have got color TVs. Clothing have changed, hairstyles have changed. Sex cannot be excluded from this, you know, revolution. So we, the older ones, will still, I mean, keep our, the way we're taught, you know, Christian morality or church morality and so on. But I don't think we'll stop this. It's just that we must just die as pure as we were and not get engaged into these things. So I agreed with one of the speakers who said, you know, there's nothing we can do. Things actually, other things are going to happen which we cannot even believe. Maybe we'll be dead, you know. Let me tell you about this paraphilia, sexual deviant behaviors. I had a patient, I'll just finish now, I'm sure people want to speak. I had a patient who was coming to me. He's a man with a foreskin which has been scratched most of the time. He has been coming there, but, you know, I didn't know what was happening and so on, with some lacerations and so on. Then eventually the wife came, but for something else. And then I said, you know what, you usually come with your husband, you don't speak, you just come with this, and he says it's some crashes during intercourse and so on. But I said, this is funny. Only to find that, no, the man enjoys sex when he penetrates what you call an armpit. The armpit has got hair there, so he put his penis there and then he performs. So that hair was what was causing all these injuries, you know. So I asked him, why don't the woman shave then? He said, no, he gets more intense, you know, arousal when his, the hair is damaging his, scratching his foreskin. I mean, it's unbelievable. No one has ever thought of such a thing, but we are going to see many, many things. And then it was a difficult thing to sort, you know, especially psychologically. And then the man is a traditionalist who didn't believe in being sent to a counselor who are knowledgeable about this to be assisted. So we're going to see many, many things which we never thought will happen. Thank you, Dan.
Thank you. Sodi is a general practitioner. He meets these people. This is person with a first-hand experience about this. I see Roche. Roche, hey, she.
Hi,
Your hand
good
is up.
evening, Doctor. Yes, I've been listening to the conversation since the beginning, and I was glad that you had opened up with some of the definitions and terminologies in relation to sexuality and also the scope of sexuality. I just wanted to speak to a certain in terms of the queer and questioning definition that you had in your slides, Doctor. It referred to whether a person was not aware, whether they don't fit into the categories, the gender categories of being woman or man, or they're unsure, and that's not necessarily the definition of that. Queer or questioning refers to either how you identify within the community in relation to your orientation or your gender identity, and the evolution of that orientation and gender identity. Then further on, I just want to just speak to, the religious experts that were brought in. I think that it's very problematic that we always look at sexuality, and especially given the topic, I would have expected a lot more from people that are dealing in this modern day and era with these conversations, because it always seems to be one of condemnation in relation to LGBTI persons. And then furthermore, it also seems to be a perpetuation of gender norms within our society, as if we've not evolved further than that. And I think when we have conversations about sex, I think the psychologist from Pretoria had said it very well, that it is a human thing, it is a diverse topic, and we can't be fixated on one notion of what should be right and wrong about it. I think inevitably we should speak about it in such a way to discuss the diversity of it as to inform and educate individuals so that they can maintain safe sexual practices, but that they can also empower themselves with information, for instance, to overcome things like sexual disorders and also sexual dysfunctions as well. And I was quite disappointed with the holistic talk that we didn't delve into some of the remedies that could be associated with some of the disorders that had been mentioned. And then finally, I just want to just speak about, this definitive and overt sense that there needs to be a certain way about policing women's bodies and their actions. It was mentioned quite a few times. Well, firstly, in terms of what polyandry is, as if it's a far-fetched notion that shouldn't be attainable, when in terms of our law and our constitution right now, it is something that may be viable, and I think that we should open ourselves to that possibility. But in addition to that, I'm also thinking about the way in which a woman was used to then speak to exposing body parts, and men are never used in the same way to kind of speak to how they are also project how they are, just unbearing themselves to women without consent, whether it be in inboxes, whether it be on DMs or social media platforms, and how we are then constantly harassed in that manner. And I think that we also need to caution against what the lawyer had said, which is really surprising for someone who should be well versed in terms of, protecting an equity and equality of the genders within South Africa, to say that women should be wary about how they dress in the workplace, when we do have workplace policies in terms of dress code, firstly, but also it's insinuating that women are only there to be sexualized and that they have no autonomy over how they look, when I think it should be the other way around, that men need to have a measure of looking at how they conduct themselves in terms of sexualizing women, and stop their own sexist ideologies in relation to the bodies of women. So I think holistically, I wish there was a more fervent discussion as well in terms of LGBTI persons, so there can be greater understanding. I understand that a lot of doctors, lawyers, and also people of religious backgrounds don't necessarily have the scope of understanding of these issues because they're not taught these things. And once we delve into that education, then the conversation broadens quite a bit. I was quite disappointed that we didn't unearth, even touch on intersex individuals in this conversation, and where we speak about biological variance in that regard. So then also speaking to, going beyond the binary of just female and male bodies and what it means to be an intersex person who is ambiguous, let's say, in terms of hormones, in terms of the internal reproductive organs and the external genitalia, and what that means for sexual disorders as well. So I think for me, the focus could have been a lot broader, but I do appreciate the conversation, and I hope that the experts also have something to learn about people that are here in the room, instead of just endorsing these views that are holistic, patriarchal, and that are very problematic in the climate where we are trying to ensure that there's the empowerment of women and the protection of people generally when it comes to issues around gender-based violence and femicide, and also issues of discrimination which are inundated in our law. Thank you so much.
Thank you, Roche. Thank you. Very nice comment. Kawana talk about Miss Chipa Bill guy.
Rona doctor Kiakwala.
Yakwala. Roche, you can put your hand down. Roche, take your hand down.
A very loaded topic, doctor. Very loaded, and I have learned a lot. That we are even told how we should behave and how we should accommodate one another, as and when we even teach our kids so that they know themselves, the issue of morals. It's very loaded. I'm happy the integration of psychologists with law, with religion. You are an all-rounder. You were quoting almost from medicine to religion and all those things. I have learned a lot. I think it's just that time is not enough. I think topics like this should be debated, or we must engage on the topic like this, because I think one said we are talking about taboo when we talk about sex. But if we share and be and be educated on these topics, we will be better people and accommodate one another and not judge other people and do things that we understand. Thanks very much, Doctor. Thanks a lot.
Thank you. Ladies and gentlemen, this is a wide topic. I want to thank all those who participated in this. We'll have to end it right here. Mostly, I want to thank our panelists, psychologists, and the reverends and the lawyer. Thank you very much. Even in future, when I've got a difficult topic, I'll invite experts, because I'm not jack of all, I don't know anything. Thank you very much. Have a nice evening.
Thank you very much. Good night, sir.
Good night.
Good night.
Good night.